Can you tell us why you would need to be isolated from your pets?
I think what the data is showing now, and this is all new, and this is just as of what we know today, when they're recommending that is not because your pet can become infected, actively infected and sick, but your pet can become a carrier. So this virus is spread aerosolized-wise. So if you cough, sneeze, it gets in the air, you can then breathe it in and get infected. Obviously, the environment gets contaminated, so tops, floors, whatever, can also get contaminated with the virus. If you then touch that and then touch your face or whatever, you can then spread the virus around. And if you have a pet, then obviously your pet also can become contaminated. So they don't become infected, they become contaminated.
So would that apply to all pets?
I think any pet, I mean, if you consider anything in the room could be contaminated, the floor, the carpet, the table, the TV, the lamp, then any animal could be. So it could be cats, birds, dogs, whatever's in that room. Obviously, if you're self-isolating in your home, then you would keep those animals at home with you until you're clear of the disease yourself. So if if it's the 14-day run or whatever, you would do the same thing. What you don't want to do then is send those animals out somewhere. If you have somebody who does dog walking or daycare or whatever, if you've been at home actively ill, coughing or whatever, then you don't want that animal, if it's contaminated, to go somewhere where someone may handle it, a groomer or somebody clipping or whatever, which clearly would be more of a risk because it would aerosolize that, hair and stuff.
So what about pet stores or the SPCA?
I think the only issue that you would have with that is if you had somebody at that store sick. So if there was an outbreak and you had several people at a pet store, a vet hospital, a grooming place, or whatever, then those animals, if you're buying them or taking them or doing or whatever, then again, you probably would want to avoid doing that. Being a vet, I don't think anyone has more sanitizing going on than we do. If there was some major worst case scenario and there's a lot of people sick, hopefully we'll have a number of staff who aren't affected, still be able to provide emergency service. If somebody is infected with the disease and their animal is sick, then obviously we need to determine how to get that animal to us.